Hi everyone, myself Dr. Kiran KC. I am a dermatologist working in Halwani, Uttarakhand. Okay. In this video, we'll be discussing about dandruff. This is one of the most common problem faced by most of us. Okay. So let's start with what is dandruff. Dandruff is nothing but the white flakiness, the small white flakiness or small scales which you usually see in your scalp. Okay. Now let's come on one more common terminology used by a dermatologist. But whenever you go to a dermatologist with a dandruff problem, sometimes your dermatologist says to you that you have seborrheic dermatitis. So let's know what is seborrheic dermatitis. Seborrheic dermatitis is a severe form of dandruff. If your dandruff is associated with itching and redness, okay, along with the white flakiness or white scales, then it is called as seborrheic dermatitis. Okay. Now let's understand why you develop dandruff. Okay. Now each hair follicle, which is the hair root which is below the skin, is attached by a oil producing gland, that is the sebaceous gland, which produces sebum. This oil, the sebum, is responsible for keeping your hair smooth and strong. Okay, in most of the people who have dandruff, there is excessive production of this oil, okay, or sebum. Okay, along with the excessive production, okay, people who have dandruff also have a fungus present. Okay, what this fungus does is it acts on the excessive oil, okay, and makes the white flakiness to develop. So there are two components. Okay, one is the excessive oil production, one is the presence of the fungus. Okay, so only oil production, okay, does not cause dandruff. Okay, it only makes your scalp oily. For dandruff to develop, there should be a fungus also present. Okay, now let's understand what are the factors which increases dandruff. Okay, first and foremost, excessive hair oil application or hair gel, okay, or hair products. Okay, second is, okay, stress. Third is, okay, high consumption of processed food or high calorie foods. Okay, fourth is improper drying of the hair. After taking a head wash, if you are not going to dry your hair properly, then the moist environment of your hair is a very good environment for the fungus to develop. Okay, fifth is usually wearing dirty helmets, dirty caps, or dirty clothes, okay, on your scalp. Okay, sixth is hormonal, particularly people who have PCOD problems or hormonal issues, or when you attain puberty. Okay, particularly at 13-14, when you attain puberty, there are a lot of hormonal changes. This can make the excessive sebum production. This can increase your chances of having a dandruff. And seventh is usually seasonal variations. Okay, usually in winter season you tend to have dandruff more. Okay, so these are the 7 factors, okay, where the chances of you having a dandruff, factors which increases your dandruff chances. Okay, so does dandruff, next question is, does dandruff only happens in your scalp? Okay, no, the severe form of dandruff which I had explained, seborrheic dermatitis, you can also find in your, okay, eyebrows, eyelids, okay, eyelashes, okay, and also in nasal sides, okay, retroauricular area, beard area, mustache area, okay, axilla, upper chest, upper back. Okay, all these areas other than the scalp, okay, you can find dandruff. Okay, that is the severe form of dandruff, that is seborrheic dermatitis. Okay, so when are you going to meet your dermatologist? When you are supposed to go to a dermatologist if you are dandruff? One is if you have any of these features, okay, along with white flakiness, okay, if it is associated with itching, okay, and redness, okay, then you're supposed to go to the dermatologist. Okay. Second is even a frequent head wash. What I mean by frequent head wash, even after washing your scalp alternate day, okay, with any of these anti-dandruff shampoos which is available in the market, okay, still you have dandruff, then you're supposed to meet the dermatologist. The third is, if other than the scalp, if the rest of the areas involved, whereas I already mentioned eyebrows, eyelashes, beard area, retroauricular area, axilla, upper part of the chest, upper part of the back, if these areas are involved, okay, along with the scalp, then you are supposed to meet a dermatologist. In these three, okay, instances, you are supposed to meet the dermatologist. Okay. Now let's understand how do you prevent dandruff. One is stop application of excessive oil, hair gel or hair products on your scalp. Okay. Second is stop wearing dirty helmet, dirty caps. Okay. And third is after head bath, properly dry your hairs. Okay. And frequent head washes. Okay. Frequent head washes, particularly you are gone outside. Okay. Particular alternate day head wash. What I suggest most of them, alternate day head wash. But if you have very few chances of dandruff, then once in 2 days is also fine. Okay. So these, if you do, then there are higher chances of you can prevent having a dandruff. Okay. Now one more question is, usually people come to me, okay, a lot of patients who come to me with the problem of dandruff, they say to me they have gone to many dermatologists, they have taken treatment. Whenever they take treatment, it gets better. Okay. But okay, once they stop the treatment, again it recurs. Okay. First thing I want to make everyone understand is, okay, dandruff can be treated. You can completely get rid of dandruff, but to maintain so that the dandruff does not recur, okay, then you should be continuing on the shampoos as recommended by the dermatologist. The reason for this is, okay, as I already mentioned, there are two components. One is the fungus, okay, one is the excessive oil production. So whenever we are treating the dandruff, we usually kill the fungus or destroy the fungus. Okay, and in this excessive oil production, we reduce the oil production. We are not going to destroy the sebaceous gland, okay, oil producing gland. This is because this oil producing gland is responsible for keeping your hair smooth. Okay, if sebaceous gland were not present, okay, if it was destroyed, then your hair would have been very frizzy and it will not grow in length itself. Okay, the smoothness of hair will have completely lost. So only we can keep it in control, the excessive production. Okay, with some of the patients have, but inherently they have excessive production. Okay, so to keep it in control, most of my patients initially I start on tablets, lotion, depending upon the severity and also the shampoo. Okay, once they get better, I usually stop the tablets after some time and also the lotion after some time. But I always advise them to continuously use the shampoo. Usually some people require daily usage of the shampoo who have severe dandruff for keep it in control. Some people maybe with alternate days also, okay, I was able to keep them under control. So this is the reasons, okay, it can be controlled, it can be completely treated, you can get rid of dandruff completely, but to maintain the status, okay, you should be continuously maintaining it with the shampoo. Most of them with the shampoo I am able to maintain them, okay, after they got rid of their dandruff. Okay, thank you. I think this was very informative and well in details. Okay, wait for the next videos. Okay, thank you.